Welcome to the Higher Power Podcast, presented by Higher Power Sports PT, the show dedicated to helping active individuals like you unlock your full potential through expert insights on injury prevention, performance enhancement, and recovery. Kurt Kessler is a board-certified specialist in sports physical therapy and an athletic trainer. In each episode, he and his guests bring you the latest evidence-based strategies to help you move better, feel stronger, and stay injury-free. Let's learn together.
Hey there, everybody. Welcome back to another episode of the Higher Powered Podcast. Today's episode, I wanted to really take a deeper dive into what exactly sports physical therapy is. I think a lot of people maybe have some misconceptions about it, or they might not even know that it exists as, I don't want to say a separate entity than general PT, because, we're all physical therapists. We're all kind of working with the same type of goal, but it's just a much more specialized experience for athletes versus general physical therapy. So a couple of things to set some ground rules here. I am going to try to be very careful not to frame one as better or worse than the other, but really just highlight the differences between the two and just kind of show what the lens of a sports physical therapist, what we kind of look at and just kind of the thought process a little bit. So what I did here is I outsourced questions to friends, fellow PTs. I kind of scoured the internet a little bit for some common topics that were coming up on either Reddit or just some online forums regarding physical therapy. And I compiled a list of 33 questions that I'm going to go through. It sounds like a lot, but I'm hoping that it's well worth your time to stick around and listen and hopefully gain a little bit better perspective of, one, what I do and how I think, but two, just learning more about sports physical therapy specifically as opposed to just like, whatever local physical therapy place is nearby your house. Okay. So first, setting the tone. Question number one, what role does general physical therapy play in healthcare and why is it so important? So I chose to be a physical therapist because of the impact I want to have on people's lives. And I worked as a general physical therapist for a year until I did my sports residency, or I should say a couple months until I started my sports residency. But just in general, physical therapy is so valuable to restore people's movements. I'm thinking even like on an inpatient setting where, you have people that are struggling to even just like be able to stand up, and the important role that plays in being able to get them to do that so that they don't have to stay in a hospital, so that they can go home. And then on the outpatient, so many of us just genuinely care about other people, and to be able to play a role in like getting them back to function, getting them back to, doing things around the house, getting them back to playing with their grandkids or their kids or, whatever their goal is. I just think there are so many things that physical therapists do and responsibilities that physical therapists have that I think sometimes go unnoticed by the public. And I think it's just a wonderful profession that gives a lot of options to us as providers, a lot of different avenues to work in, but also just like I think there's so much that the physical therapy profession can offer to people that they may not realize. Question two, why do you think it's a mistake to frame sports PT as better rather than different? My answer to this is that better is a relative term. What's better for one person may not be better for the next person. I would frame it as sports physical therapy is more specific, especially for athletes. It's more specific to a population, more specific to a goal, an athletic goal. So there's no better or worse, but it should be more specific to people who want to get back to something athletic or something active. Question three, in your experience, what do traditional PT clinics actually do very well that athletes should appreciate? For the most part, they get people out of pain. In my current business, I've utilized and have been thankful for general PT for post-op cases, especially with fully remote clients. It's great for getting your baseline strength back. It's great for getting range of motion back. Just really getting the foundation of movement back after surgery, I think, is a big thing, especially for athletes. So I think the traditional setting does really well for that. Getting more into the specifics of sports PT, question number 4. When someone hears sports physical therapy, what do you think they usually misunderstand about it? And I think they misunderstand that it's either that it's only for athletes or that it involves just like on-field sports-specific training, which is really like the last 10 to 20% of rehab. I think sports physical therapy can work for general populations, and I'll probably get into that in another question. But I think people think that it's like you have to be like on a team or pursuing some sort of activity or some sort of just like really heavily involved with a current sports team. Question 5, if you had to explain sports PT to a 16-year-old athlete or a parent in plain language, how would you describe it? I would use an analogy. I would say, imagine you're a NASCAR driver or someone who has a car that like needs to get performance out of it. Not a car that just drives you to work and back. A car that needs to drive fast with precision and compete for something. Would you take that car, if you own that car, would you take that car to the general mechanic that, has a garage down the street? Maybe. You could. It's still a car. But if you're putting a lot of money into this race car, and I liken that to like playing sports or playing club sports or, playing a million club sports and super overloading your body in the way that you're doing with a race car, or even if you just want to get the most out of it, you would probably want to take that race car to someone who is used to working on race cars. That's the analogy that I would draw, because athletes have a very different skill set. They have very different needs than general population. And someone who is a sports physical therapist really should have that background knowledge of what exactly they need. Question 6, what makes a physical therapist a sports PT? Is it the population they see, the mindset they bring, or the way they make decisions? Yes. Sports PT is not a protected term, meaning anybody can say they are a sports PT. When you graduate PT school, you operate as a generalist PT. You then have the option to specialize, and there are 13 different specialties recognized by the governing body of physical therapy. To specialize, you can either work 5 years and then take a test, or you can do a residency, which is a year-long intense training program that basically gives you somewhere between 5 to 7 years worth of experiences rolled into that 1 year. And then you have to take a $2,000 5-hour test and pass it to receive the credential. For me, that is the SCS credential behind my name. People with that credential are sports PTs. They have that training. Now, that's not like the only ticket to get you in the gate, but people with that are for sure sports PTs. For those that don't have that credential, like you can have an athletic background, like an athletic trainer, like I do as well. Or you could just have a lot of experience either with continuing education or work experience. There's nothing wrong with that at all, but it is in the population they work with, the mindset, the skill set, and I'd say utilizing strength and conditioning principles. It's just harder to identify those individuals because there's not something you can really search for, or if you do search for it, it's just a lot harder to find. Question 7. How does the way a sports PT assesses an athlete differ from a more traditional PT evaluation? Probably the biggest thing is the understanding of what different athletes need versus general population. For example, a baseball pitcher generally needs their big toe to extend up to like 90 degrees, where the average person can get away with like 60 degrees. Another example would be a football quarterback needs like 120 degrees of shoulder external rotation. A baseball pitcher needs like 135 degrees of shoulder external rotation, whereas the average person needs like 90. If a thrower has that extra external rotation, their internal rotation will be less than the average person. In general PT, you might work with someone who might only work within the guidelines of what the general population needs. So if I'm a baseball pitcher and I need to get 120 to 135 degrees of motion, but the PT's only getting you to 90, well, then that ends up causing some issues. And that's where the specialty of sports PT comes in. That's one example of many, but I think it's the easiest one to illustrate. Question 8, why does sport-specific context matter so much when you're evaluating pain or injury? I think the same as the previous answer. You need to know what the specific sport calls for so that you can train the body specifically. Question 9, can you give an example of how the same injury might be treated very differently depending on whether the patient is an athlete or a general population client? I'm going to flip this from athlete versus gen pop client to sports PT versus generalist PT, because the way I would treat gen pop is actually very similar to an athlete. Like their plan of care would just likely be a little bit shorter because we wouldn't need to achieve that like extra level of function like an athlete would need. So a sports PT, I would think, would adhere to more strength and conditioning principles of dosing for exercises for strength. Think like squats. A general PT might dose it as like 2 sets of 10 holding 5-pound dumbbells, where a more sports-minded PT would do strength testing or 6-rep max testing and find that their threshold is actually like 3 sets of 8 holding 30-pound dumbbells. And I'll say with my residency training, one big difference is that we were taught not to guess anything. Like, don't throw stuff at the wall and see what sticks, but instead assess it first and then provide a specific intervention. So I think the specificity of maybe a few exercises dosed appropriately versus like 20 exercises dosed very lightly or very generally. Question 10, how does exercise selection change when the goal isn't just feeling better, but returning to competition? I'm going to give a 3-part answer to this question. Exercise selection, so dosing, we just kind of talked about that. We can do general dosing and it will help the body to adapt and have less pain. But the more specific dosing for strength, endurance, even pain relief is going to change that from staying general versus being dosed with specific intent. And then understanding progressions like tissue tolerance, the demands of different sports will all heavily influence exercise prescription. Part 2, I would say the next thing is that mindset becomes big. Almost everyone is of the mindset like once I'm out of pain, the injury is healed or the injury is 100%. But pain is just like step 1. And for most people, that's where it stops, and they return to play at far less than 100%, and they end up getting re-injured. The right education and mindset from the start is going to properly align expectations so that we are achieving more than just pain relief. Like pain relief cannot be the primary goal. we can achieve pain relief by resting and doing nothing, or prescribing heavy medication or substances. So like that pain relief is just, it's not the goal. And my third part of the answer, here's where business type comes into play a little bit, in my opinion. Insurance companies are like hawks searching for things to stop service, trying not to pay for services. The benefit to cash pay is that you have far more freedom to create a plan of care that extends beyond getting out of pain, not getting cut off from insurance, getting to advance to higher levels of activity. The trade-off then is, of course, paying for it instead of having insurance dictate what you can or can't do. Question 11, what role does strength, power, and load tolerance play in sports PT compared to traditional rehab? Honestly, it really shouldn't be any different in either setting. When I was in traditional rehab, I was working on all of these things. The only difference may be the time that it takes for an athlete to truly gain the strength they need to. It might be a 3-month, 6-month process to fully make up strength deficits for some people. And at that point, you're not doing that in the traditional setting because you won't be approved to go there that long. You can do return to sport in the traditional setting if you're creative enough. I'd argue it's not like super comparable to the actual sport demand. So that could be a small limitation, but to me, it's more of a, have we measured everything appropriately to determine return to sport? That's not a setting thing. That's more of a clinician thing. That's more of a this PT versus that PT type of thing. Question 12, why do you think athletes often feel under-challenged or held back in traditional rehab settings? One of two things, and we've talked about them already. Either they are underdosed, the PT is not dosing exercise appropriately, so they're underdosed and not getting much out of it, or because the clinic itself might not have enough weights to make a difference. When I was in the traditional setting, my clinic did have a lot more equipment than the average clinic within our company. So I did have access to higher dumbbells. I did have access to a leg press machine, some other machines. But I've also covered in clinics where the most weight that they have is a 10-pound dumbbell. And so for athletes, when you think about like they have to move people that weigh hundreds of pounds, 10 pounds isn't really going to get them close to that. I did an evaluation of a high school athlete, and I asked her dad why they sought my services instead of traditional rehab. And the dad said that she's an athlete and she needs to move real weights instead of the little weights in that setting. And the last time they were in that setting, they just had her on the table the whole time. Now, ironically, they did not end up doing a plan of care with me, and they opted to go back into the insurance route. But I at least referred them to a PT that I knew would treat her well. Question 13. One of the biggest fears athletes have is re-injury. How does sports PT approach return to play differently? To start, sports PT addresses it for sure. General PT, I'd be willing to bet that you don't always get return to sport guidance. Like their strength testing by hand might be the deciding factor for some PTs. And look, that's not to rag on those PTs. It literally might be the best they can do. They might not have any devices to objectively measure strength besides their hands, and that's not their fault. And they may not have the training or knowledge for return to sport. So strength testing is the best of their knowledge, and they're doing their best. But I mean, that's exactly the difference. Sports PT should be able to more objectively assess strength measurements, should have the knowledge of progressions back into sport, should be able to test readiness for sport. My answer to this question is that sports PT has an approach where general PT doesn't always. On episode 21 of this podcast with Logan Crowell, he outlined his return to play when he was in high school. They never did anything more than light side shuffling on a treadmill with him, and then on his last day, they told him to sprint down a hallway and cut off of his injured leg, and that was it. That ain't it. That's not how things should be done, especially when you're trying to prepare athletes to go back onto the field, withstand a whole bunch of demands and forces, and that's the testing that prepares them for it. That's just falling short of the mark. Question 14, what does clearance actually mean in sports PT, and why is it often misunderstood? This one's dangerous, very dangerous, because clearance means different things to different professions and different people. For example, ortho docs will clear based on patient reports and the reports they get from the patient's physical therapist. Some physical therapists will clear based on some things that I already discussed. Sometimes clearance looks like insurance not paying for any more PT, so they're forced to be done, and therefore they're cleared. For me, in the most simplest explanation I can give, I want to see full and equal strength, left versus right. I want there to be no pain. I want equal jump tests, hop tests, and power dynamics. I want a baseline of chronic workload to be established. I want there to be an on-field practice progression, and I want full reintegration to team practice before clearing them to play in a game. As an athletic trainer, speaking on the athletic training side of things for me, that's not what happens. Kids will go back from injury early with the understanding that the goal is to allow them to play during the season. But in the postseason or after their season's done, they should be addressing all of these things that we didn't clean up during the season. If I held every athlete to that standard, then most of them would be missing the entire season, and that's not what most of them are there for. But if I'm working with someone on the sports PT side who has real goals or real life stuff at stake, then that's the criteria that they should be meeting for me, because that's what makes the process a success. Question 15, why do you believe rehab should prepare athletes for the worst case scenario, not just ideal movement patterns? Because the worst case scenario happens. One kid that I just finished working with, he had a massive labral tear in his shoulder. He had it repaired. He did traditional PT with a very good PT. I know the PT well. He came back to lacrosse, and within a month or so, he subluxed his repaired shoulder again. And then that's what ultimately led with the kid working with me. And when I started working with him, I measured a 30% strength deficit in most of his functional movement patterns. We worked together for 6 months on all the stuff I just mentioned, and he's now ready to start his lacrosse season that's coming up in about 6 weeks from this recording. In his rehab, I put him in very similar positions to how the injury and re-injury happened, and build up his tolerance to those positions so that if he is in them again, he has a better chance to withstand. Question 16, from an athlete's perspective, how does working with a sports PT typically feel different from traditional PT? I don't know, really. Probably the understanding of what they do or what they have to do in sport. Probably a lot of the communication, maybe the environment or the setting that the rehab takes place in. Maybe some of the things I talked about earlier, but just building real strength. Question 17, how does communication style change when you're working with competitive athletes? To me, it doesn't change. I try to speak the same language or with the same intent no matter who I'm working with. The key, though, is speaking the language of whatever activity is important to them. But one thing I try to do is always keep looking ahead, keep showing them the next step so that they know what they are working towards. Someone else would likely have a better answer than me, but that's what I would say. Question 18. Why do you think athletes often say, this feels more like training than rehab, and why is that a good thing? Because when it's done really well, the blend of training and rehab should be seamlessly overlapped. It's okay for rehab to look like rehab, but the problem is that it often ends there and doesn't progress to look like they're training. Question 19, is sports PT always necessary, or are there situations where traditional PT is absolutely the right fit? It just ties back to the goals, I think. If you have specific goals, then I think the rehab process should match that. If you're an athlete, I do think you should be seeking sports PT. It's not wrong if you choose general PT because there are a lot of factors that go into the decision-making for your care. But I do think you should be seeking sports PT. It can look different in different settings, but it should be sports-minded. Question 20, what types of athletes benefit the most from sports-specific care and who might not need it? My simple answer here is if the issue is impacting your sport, then sports PT is warranted. If it's not impacting your sport, or if you, if it's just something very general, then general PT is fine. Question 21, if an athlete is unsure which route to take, what questions should they ask a PT to figure it out? This is tough because it involves some courage and some self-advocacy from the patient, and it takes some honesty from the PT. I would say try to find out some background information on the PT's experience to see if they have experience with what you're looking for. I would ask them what their plan is to get you to each milestone. I would ask them what return to play looks like. And I would try to find out what kind of weight or equipment the clinic has, because if you are an athlete and if you are a serious athlete, all of those things should really be addressed. The environment should have what you need. The physical therapist should have a plan, and the physical therapist should have very clear return to play criteria so that we're not just throwing you back out on the field without making sure you're ready. Question 22, how do insurance models and clinic structures influence what PTs can realistically offer athletes? I think it's easy to say that the cash-based model offers more opportunity for sports PT, only for the simple fact that there's no limit on the care that you can provide. With insurance, there's always going to be a limit. And I'm not saying good sports PTs don't exist in the insurance realm. That is not what I'm saying at all. But I do think insurance at least limits the experience either in duration of care or potentially what you're allowed to do, because most insurances won't recognize sports and return to sports as viable goals. Question 23. Why do you think many great PTs struggle to provide sports level care inside traditional systems? The way the question is worded, I can only give one answer, and that's volume. This is going to be dependent on the PT. For me, one-on-one care is superior in this setting. I know that not every PT enjoys treating one-on-one, but my argument is that to be as detailed as I want to be with movement, I can't be working with more than one person and expect top-level results. I don't know how anyone can split their attention and their literal vision to pick up on some of the more fine details, but that's just me. Question 24. What are some things athletes don't realize about time constraints, visit caps, and volume in standard clinics? All of this is insurance dependent. So it depends on whatever your insurance says or whatever insurance plan you have. Each insurance plan may carry a different number of visits that you're allowed per year before they stop paying. So there are times where a person's plan or their frequency may be determined by trying to conserve visits. For example, people may have an upcoming surgery. They do one pre-surgical visit, for information when they'd really benefit from actual work before the surgery. But they need to save visits for rehab after the surgery. So that's one common thing I see. Time constraints and volume kind of go hand in hand for me. I was fortunate that the clinics that I worked in only expected the industry standard. I have friends who worked in clinics where an individual PT would see 70, 80, 90, north of 100 visits per week. So you want to give everyone time, but you can't spend too much time with any one person because the next group is coming in. I never understood how anyone could be effective at that volume, but again, that's just me. Question 25, what additional training or experiences tend to shape a PT into a strong sports clinician? Orthopedic or sports residencies, an undergraduate degree of athletic training, that dual degree. We are going to become like dinosaurs soon because athletic training has moved to a master's level program. So people will be less likely to do a master's in athletic training and then a doctorate in PT. But the rest really comes down to continuing education, even like consuming the right things on social media. There's just so much garbage out there, but there's also gold. And my wife makes fun of me because our Instagram feeds look very different. I am only on there for two reasons, and that is one, to market my services, and two, to consume education to make me better at what I do. I don't care about what people had for dinner or the fake stuff and worldly stuff that's on there. I just want to get better, so that's what I'm on there for. Question 26, why does being around athletes, teams, and competition environments matter so much? For me, it just provides endless motivation because you can see right in front of you what the athlete is striving for, what they need to be able to do, a little pressure that you feel to get them back for the team. I think it just helps push you forward a little bit. Question 27, how does continuing education differ when your primary population is athletes versus general patients? This is where we have the opportunity to make our careers what we want them to be by learning about what we're passionate about. 95% of my continuing education is for sports PT, but the other 5% is for me to consider other areas to be aware of, like maybe nutrition or psychology as it relates to injury in athletes. Advice for athletes and parents, question 28. If an athlete could only remember one thing from this conversation, what should it be? That the goals of sports physical therapy should match your goals in your sport. And that there are people like myself that specialize in the sports realm, and those things should look and feel a lot different than the traditional setting. What are red flags that an athlete's rehab might not be preparing them for their sport? If they are not being challenged by their exercises, if the exercises are too easy, if they haven't been taught how to do the exercises appropriately, and if there's no clear return to sport progression that looks similar to your sport. Question 30, what should parents look for when choosing PT care for a young athlete? Again, I kind of addressed this earlier, but it's really tough because I don't want to say things that pump me up for the sake of just like making it sound like I'm better, because that's not my belief and that's not how I operate. However, I do think if you're serious about sports rehab, the easiest thing to look for is the SCS credential, because there is a lot of training and effort that goes into receiving that credential. And like that's, to me, that's just like, that's the most specific thing you can look for in terms of knowing that someone is going to have that athletic background. And again, I think just some of the things that I mentioned earlier, just like knowing the PT, maybe asking the PT hard questions and seeing what answers you get. If I don't know the answer to a question, I will tell someone that I don't know, but I'll try to find it out. But if you feel like the PT is just kind of coming up with things to try to sell you, then I think that's probably a red flag. Look for the SCS credential. Look for the environment to either somewhat look like a gym setting that could challenge you, or a field setting where you can work on a couple things. I think that's what my best advice would be. And then the last section here, question 31. What do you wish athletes understood about their bodies and performance earlier in their careers? The biggest thing I wish athletes understood is that the absence of pain does not mean you're 100%. Pain relief just allows you to go to the next level, but that is often where care and the work stops. I've done episodes on this in the past, and will continue the episodes to bring education to people about this topic, because it is the most overlooked thing in rehab, especially for athletes. Question 32, if the goal is longevity, not just getting back fast, how does sports PT support that? I mean, that's really my whole thing. I have the ability to get people back fast, but it also comes with a lot of education on what we're leaving on the table, or what risks come along with certain decisions, which with the people that I work with, I'm very open and honest about. My philosophy is to really restore competitive and recreational athletes to 100%, and at least give them the guidelines to continue to participate in a safe way. But I think that education needs to be given by the therapist and considered and received by the athlete. Last formal question here. How can athletes advocate for themselves within any PT setting to get better outcomes? Best thing you do is ask questions. There should be a clear plan in place for you. That doesn't mean it can't change, but there should at least be a clear plan in place. There should be clear criteria to reach the progressions. I know actually some athletes don't want to know this, because they get frustrated when they can't reach certain criteria, and then they lose patience with the entire process. But keep asking questions, because the therapist should have a plan and a reason for what they're having you do. Quick rapid fire here. Pain-free versus performance-ready. What's the difference? Pain-free leaves you well short of your normal performance. Performance-ready has addressed all of those factors to make sure that you're ready to play. Rehab versus training, where's the line? I said this earlier. If it's done really well, the line should be pretty blurry. Mobility or strength, what do athletes usually over-prioritize? Athletes and people in general over-prioritize mobility and under-prioritize strength. Or they assume the reason that something hurts is because it's not mobile or it's not moving well. It's actually usually because it's not strong or not moving well. Rest or load, what actually fixes most issues? Rest helps calm the symptoms. Appropriate load helps to fix the issue. All right, that's it. Made it through 33 questions and 4 rapid fires. I hope that everybody was able to just maybe gain a new perspective on what sports PT is, why it's different, or how it's different than general PT, And more than anything, just being able to make a more informed decision on what kind of care you actually need, what kind of care actually matches your goals that you have for either your life or your sport or performance, whatever the case may be. I just hope that I was able to bring a little bit of humble clarity to some of those questions, some of those issues. That's going to do it for today's episode of the Higher Powered Podcast. Thank you to all for listening. If you're looking for ways to connect, you can find ways to do so in the show notes or find me on Instagram at Higher Power Sports PT. Thanks, and we'll see you next time.
That's a wrap for today's episode of the Higher Powered Podcast, presented by Higher Powered Sports PT. We hope you gained valuable insights on how to stay strong, move better, and prevent injury, all backed by expert knowledge in sports physical therapy and athletic training. If you enjoyed today's episode, don't forget to subscribe, rate, and review. Your support helps us bring more evidence-based tips and strategies to active individuals just like you. For more resources or to connect with us, head over to hpsportspt.com. That's hpsportspt.com. Remember, you've got the power to perform at your best. Keep training smarter, recovering faster, and living stronger. Just a reminder that the content shared in this podcast is for informational and entertainment purposes only. It should not be considered medical advice. Always consult with a qualified healthcare professional before making any changes to your health or treatment plan. Thanks for tuning in. We hope to see you next time on the Higher Powered Podcast.